Good day! I'm Rosalie Custodio, your teacher in Grade 9 Science. In the previous lesson, you have learned the negative effects of cigarette smoking. Today, you will learn the causes, prevention, and treatment for common respiratory and circulatory diseases. Are you ready? Let's get started. Lesson 2.2 Prevention and Treatment of Respiratory and Circulatory Diseases. In this lesson, you will be able to identify ways of detecting, preventing, and treating diseases in the respiratory and circulatory systems. The leading causes of death around the world are diseases affecting the respiratory and circulatory systems. However, they can be prevented simply by having a lifestyle that promotes wellness. Circulatory and respiratory diseases begin to develop with unhealthy lifestyle. Symptoms of these illnesses must not be neglected, and appropriate care must be given immediately. Let's recall, there are negative effects of smoking both on the circulatory and respiratory systems. Below is the list of diseases or illnesses that might develop due to smoking cigarettes. Categorize each disease whether it falls under the respiratory or circulatory system. Coronary heart disease, pneumonia, asthma, tuberculosis, hypertension, vascular disease, arteriosclerosis, chronic bronchitis, lung cancer, emphysema. Good job! Coronary heart disease, hypertension, vascular disease, arteriosclerosis, they are all diseases under circulatory system, while pneumonia, asthma, tuberculosis, chronic bronchitis, lung cancer, and emphysema, they are all diseases under the respiratory system. Respiratory disease that affect your airways and lungs is caused by infection, smoking cigarettes, or by breathing in secondhand cigarette smoke or other forces of air pollution, while circulatory disease is an interruption, blockage, or diseases that affect how your heart or blood vessels pump blood. Diseases of the blood vessels and the heart are known as cardiovascular diseases. There are ways to prevent circulatory diseases by living a healthy lifestyle. Now, here are some of the common conditions affecting the respiratory and circulatory system. Respiratory system diseases. Number 1. Asthma. Asthma is caused by inflammation in the airways inside the lungs, also known as the bronchi and the bronchioles. Airborne allergens can cause inflammation, such as dust mites, pollen, mold, and animal dander. An asthma attack may be triggered by airborne substances, certain foods, or common bacteria and viruses that are ordinarily harmless. The reaction of the airway causes spasms or uncontrolled contractions of the smooth muscle in the bronchial tubes. The inflamed mucous membrane lining the tubes also swells. As a result, the person wheezes, coughs, and has difficulty breathing. Asthma attacks can be relieved with drugs that treat or prevent inflammation, relax the bronchial muscles, and open up the air passages. Quick relief medication is often inhaled directly into the lungs, which causes the muscles to relax and opens the airways. Number 2. Lung cancer. Lung cancer is marked by uncontrolled cell growth in the tissues of the lung. Risk factors include tobacco smoke, radon exposure, asbestos exposure, arsenic in drinking water, past exposure of lungs or chest to radiation therapy, and family history of lung cancer. Symptoms include the following: persistent cough, shortness of breath, chest pain, and unexpected weight loss. Treatment options includes the following: surgical removal of cancer tissue, chemotherapy to kill cancer cells, and radiation. Number 3, tuberculosis. Tuberculosis is an infectious disease that can be transmitted through air droplets that spread from one person to another person, like coughing, sneezing, talking, and laughing. This disease is caused by a bacterium called Mycobacterium tuberculosis, which attacks the lungs and can spread into the different parts of the body. Symptoms include cough that lasts more than 3 weeks, prolonged and persistent fever, and unintentional and unexplained weight loss. Prevention and treatment includes the following. Number 1, get a BCG vaccine for prevention. Number 2, cover your mouth and wear a mask while interacting with an active TB patient. Number 3, get a regular health check done. Number 4, multi-drug therapy treatment for at least 6 months. And number 5, directly observed therapy. Number 4, bronchitis. Bronchitis is an inflammation of the air passages between the nose and the lungs, including the windpipe or trachea and larger air tubes of the lung that bring air in from the trachea or bronchi. Bronchitis can either be of brief duration or acute, or have a long course or chronic. Acute bronchitis is usually caused by a viral infection that can also be caused by bacterial infection and can heal without complications. Chronic bronchitis is a sign of serious lung disease that may be slowed but cannot be cured. Causes of acute bronchitis includes viral and bacterial infections, environmental factors, and other lung conditions. First, viral infection. Viruses cause 85 to 95% of acute bronchitis cases in adults. The same viruses that cause the common cold or flu can cause acute bronchitis. Second, bacterial infection. In rare cases, bacterial bronchitis can develop after a viral infection of bronchitis. These can result from infections by bacteria such as Mycoplasma pneumoniae, Chlamydia pneumoniae, and Bordetella pertussis, which causes whooping cough. Third, irritants. Breathing in irritants such as smoke, smog, or chemical fumes can cause inflammation in your trachea and bronchial tubes. These can lead to acute bronchitis. Fourth, other lung conditions. People with chronic bronchitis or asthma sometimes develop acute bronchitis. In these cases, acute bronchitis is not likely to be contagious because it's not caused by infection. Signs and symptoms. Signs and symptoms of both acute and chronic bronchitis includes the following: persistent cough, which may produce mucus, wheezing, low fever and chill, chest tightening, sore throat, body aches, breathlessness, headaches, black nose, and sinuses. One of the main symptoms of acute bronchitis is cough that lasts for several weeks. It can sometimes last for several months if the bronchial tubes takes a long time to heal fully. Treatment. Most of the time, bronchitis goes away on its own within a couple of weeks. If yours is caused by bacteria, which is rare, your doctor may give you antibiotics. If you have asthma, allergies, or you're wheezing, she might suggest an inhaler. This helps open up airways and makes it easier to breathe. To ease your symptoms, you can first drink a lot of water. 8 to 12 glasses a day helps thin out your mucus and makes it easier to cough. Second, get plenty of rest. Third, take pain relievers to help with both pain and fever. transport, use humidifier or try steam. Number 5. Emphysema. Emphysema is a chronic lung condition involving damage to the alveoli, the tiny air sacs in the lung which allow for rapid gaseous exchange, the exchange of oxygen and carbon dioxide molecules to and from the bloodstream. There are about 3 million alveoli in the normal lungs. The alveoli stretch as we breathe in air, drawing oxygen in and transporting it to the blood. The alveoli shrink when we exhale, forcing carbon dioxide out of the body. With emphysema, the lining of the alveoli becomes damaged beyond repair. With this damage, the inner wall of the alveoli weakens and rupture, resulting in larger air spaces rather than many. The surface area of the lungs becomes reduced. Causes. The major cause of emphysema is long-term exposure to irritants, including smoking. This is the number one factor. Studies show that smokers are about 6 times more likely to develop the condition than non-smoker. Air pollutants in the home and workplace such as chemical fumes and dust, genetic factors, and respiratory infections. Factors that may increase the risk of developing the condition like smoking, age, exposure to second smoke, working or living in areas exposed to high pollution or chemical fumes. Symptoms include the following: shortness of breath, coughing especially during exercise and physical exertion, weight loss, exhaustion, and rapid heart rate. Treatment. The damage associated with the condition can be reversed, but treatment options can help relieve symptoms and slow down the progression of the condition. Bronchodilators to help relax constricted airways, making breathing easier and relieving coughing and shortness of breath. Antibiotics to fight the infections that can worsen your condition. Inhaled steroids to help relieve shortness of breath. Rehabilitation program to teach breathing exercises and techniques. Circulatory system diseases. Number 1. Stroke. A stroke is a medical emergency. Strokes happen when blood flow to your brain stops. Within minutes, brain cells begin to die. Symptoms of strokes are sudden numbness or weakness of the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance or coordination. Sudden severe headache with no known cause. If you have any of these symptoms, you must get to a hospital quickly to begin treatment. Acute stroke therapies try to stop a stroke, while it is happening by quickly dissolving the blood clot or by stopping the bleeding. Post-stroke rehabilitation helps individuals overcome disabilities that result from stroke damage. Drug therapy with blood thinners is the most common treatment for stroke. Number 2. Arteriosclerosis. Arteriosclerosis is a circulatory condition that is characterized by hardened arteries and restricted blood flow to organs and tissues in the body. Arteries are normally flexible and elastic, but they can become stiff and inflexible with age. Arteriosclerosis is also commonly called hardening of the arteries, and it is definitely a threat to your overall health. Arteriosclerosis often occurs at the same time as a condition called atherosclerosis, and the terms are sometimes incorrectly used interchangeably. Atherosclerosis refers to the buildup of so-called plaques or fats, cholesterol, and other substances that clog blood vessels and restrict blood flow. As these plaques accumulate, arteries grow thicker and stiffer. Plaques can cause damage to the artery, which may result in a life-threatening blood clot. While the exact cause is unknown, these diseases often develop in those with the following condition: high blood pressure, high cholesterol, high triglycerides, a type of fat in the blood, insulin resistance or diabetes, inflammation from diseases such as arthritis, lupus, or infections. Smoking and using other types of tobacco are also known risk factors, as are obesity, lack of exercise, and poor diet. Symptoms don't usually appear until an artery becomes so narrowed or clogged that blood supply to important organs is inadequate. If blood clot is present, it may completely block circulation. Moderate to severe symptoms depend on which arteries have been affected and may include the following: chest pain or pressure, known medically as angina, sudden numbness or weakness in your arms or legs, difficulty speaking or slurred speech, temporary loss of vision in one eye, or drooping muscles in your face. Number 3, atherosclerosis. Atherosclerosis is a specific type of arteriosclerosis, a condition which occurs when your arteries harden and thicken. This reduces the volume of blood that carries oxygen and nutrients to your tissues and organs. Many people think the terms atherosclerosis and arteriosclerosis mean the same thing. But actually, atherosclerosis refers specifically to fats, cholesterol, and other substances, generally known as plaque, which accumulate on artery walls and inhibit circulation. The exact cause of atherosclerosis is unknown, but doctors believe it probably starts with damage or injury to the inner layer of an artery. The damage may be triggered by high blood pressure, high cholesterol, or high triglycerides. Obesity, diabetes, and smoking are also well-established risk factors. Furthermore, atherosclerosis can be caused by infections and inflammation triggered by certain diseases like arthritis and lupus. Lack of exercise combined with an unhealthy diet can be a risk factor too. Atherosclerosis develops gradually and most people are unaware it's happening. Symptoms don't appear until an artery becomes so narrowed or clogged that it can't provide all the blood your organs and tissues need. Symptoms may include chest discomfort, numbness in the extremities, slurred speech and vision problems, and hypertension. Number 4, aneurysm. A brain aneurysm is a bulge that forms in the wall of a weakened artery in the brain. An unruptured aneurysm usually causes no symptoms. In rare cases, aneurysms can grow big, leak, or explode. Bleeding in the brain, also known as hemorrhagic stroke, is very serious and requires immediate medical care. Aneurysms often develop at the base of arterial branches in the brain because the arteries are weakest at these points. It's also possible to have a blood vessel defect at birth. Aneurysm can cause a wide range of symptoms. A small aneurysm that has not ruptured may not cause noticeable symptoms. See a doctor if you are experiencing the following symptoms of an unruptured aneurysm: headache, dilated pupils, impaired vision, speech issues, weakness or numbness in one side of the face. When an aneurysm ruptures, it often causes sudden severe headaches. The pain is frequently described as the worst headache of the person's life. A ruptured aneurysm can also cause nausea and vomiting, drowsiness, loss of balance, stiff neck, dilated pupils, sensitivity to light, blurred or double vision, drooping eyelid, and seizures. Number 5, heart disease. There are many different forms of heart disease. The most common cause of heart disease is narrowing or blockage of the coronary arteries, the blood vessels that supply blood to the heart itself. This is called coronary artery disease and happens slowly over time. It's the major reason people have heart attacks. Other kinds of heart problems may happen to the valves in the heart, or the heart may not pump well and cause heart failure. Some people are born with heart disease. You can help reduce your risk of heart disease by taking steps to control factors that put you at greater risk, such as the following. Number 6, hypertension. When your heart beats, it pumps blood around your body. As the blood moves, it pushes against the sides of the blood vessels. The strength of this pushing is your blood pressure. As your heart pumps, the flow of blood in your arteries and your blood pressure rises and falls in a regular wave pattern. Pressure is shown as two numbers. The top number, or systolic pressure, is pressure when your heart beats. The bottom number, or diastolic pressure, is the pressure when your heart relaxes. Healthy blood vessels can stretch to allow for these changes in pressure. Damaged blood vessels are less stretchy, which increase blood pressure. Constant high blood pressure puts extra strain on your heart and blood vessels. Over time, this increases your risk of heart attack or stroke. It can also cause problems for your eyes and kidneys. High blood pressure speeds up the process of atherosclerosis, where fatty streaks form inside the arteries. If one of these cracks, it can cause a blood clot in your arteries. This is what causes a heart attack or stroke. It's never too late to make changes to protect your heart. Think about your future. Being there for your family, your plans, and dreams. Could your blood pressure affect this? There are steps you can take today to lower your risk. Stop smoking. Make heart healthy eating and drinking choices. Move more. Number 7, anemia. If you have anemia, your blood does not carry enough oxygen to the rest of your body. The most common cause of anemia is not having enough iron. Your body needs iron to make hemoglobin. Hemoglobin is an iron-rich protein that gives the red color to blood. It carries oxygen from the lungs to the rest of the body. Anemia has 3 main causes: blood loss, lack of red blood cell production, and high rates of red blood cell destruction. Conditions that may lead to anemia include heavy periods, pregnancy, ulcers, colon polyps or colon cancer, inherited disorders, a diet that does not have enough iron, folic acid, or vitamin B12, blood disorders such as sickle cell anemia and thalassemia or cancer. Aplastic anemia, a condition that can be inherited or acquired. G6PD deficiency, a metabolic disorder. Anemia can make you feel tired, cold, dizzy, and irritable. You may be short of breath or have headache. Your doctor will diagnose anemia with a physical exam and blood test. Treatment depends on the kind of anemia you have. Let's remember, the leading causes of death around the world are diseases affecting the respiratory and circulatory systems. However, they can be prevented simply by having a lifestyle that promotes wellness. Circulatory and respiratory diseases begin to develop with unhealthy lifestyle. Symptoms of these illnesses must not be neglected, and appropriate cure must be given immediately. Depending on the respiratory and circulatory condition, medications are based on the severity of the diseases as recommended by doctors. Respiratory and circulatory diseases are common. Both of these diseases are easily treated, while others may cause severe illness or death. If any part of the respiratory and circulatory system is not working properly, a human being can have diseases. And if not treated early and properly, this may lead to death. Many times, people are more likely to get respiratory and circulatory diseases, but environmental exposure could also play a big role. Now, prevention on both respiratory and circulatory disease is always better than their treatment. Diseases of both respiratory and circulatory systems should not be taken for granted because they can be deadly. With the right treatment of these diseases, it can save the patient's lives. The following are some ways to prevent respiratory and circulatory diseases. Number 1, good nutrition. Good sleep and rest enhances your immune system that helps the body to resist infections. And avoid eating high cholesterol and fatty foods. Number 2, do not smoke. Cigarettes contain harmful substances that can be fatal to your body. Number 3, exercise regularly if it improves the health of your lungs and heart. Number 4, observe strict personal hygiene. Always keep your body clean because it will reduce the risk of catching any diseases. And number 5, avoid crowds. Avoid direct contact with persons suffering from respiratory diseases. To avoid contamination, it is very important to take all the necessary precautions. For your activity, write 3 respiratory and 3 circulatory diseases on the first column and fill out the required information. Write your answers on your notebook and submit to your teacher. So that's end our lesson for today. Watch out for the next topic of grade 9 science lesson. Read your modules and answer the questions appropriately. Once again, this has been your teacher, Rosalie Custodio. Till next time, learners, have a nice day!